Morning. Am I audible? Am I audible to all? Great. Good morning, all. We are starting our reading club with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना.
Good morning, all. We are giving tribute to a great master, Dr. Samuel Hahnemann, for this divine medical science as a gift to all of us. We are seeking blessings from our Guru, Dr. Prafull Vijayakar, sirs, who have bridged this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakar. So friends, we are in the journey of understanding the wisdom of Master Samuel Hahnemann from the organ of medicine, fifth editions. So till now we have understood the theoretical part and we are continuing with the practical part of how to apply the medicinal knowledge to the disease part. So there are a different way what Master Hahnemann is telling us guide in our practice. So in yesterday's aphorism, where we have found that when we have a disease of a few symptoms or one or two symptoms, at that time what to do. Most of time, Master Hahnemann advised that these symptoms are very striking and violent in nature, and it will give you a characteristic symptom. But whenever you didn't find this, then what to do? So this is what the wisdom continued by Master Hahnemann to all of us. So whenever we have some PQRS or tracking symptoms, at that time that symptom has to be what we called as the giving the result in each and every case is when you are considering the SSPUS, that means striking, singular, peculiar, uncommon, or characteristic symptom. But however, in aphorism number 179, what Master Hahnemann is telling that, however, more frequently, that means frequently it happens, the medicine first chosen in such cases, that means the cases of one-sided disease, will be only partially. That means this is what Master Hahnemann himself felt this, and he has experienced that the first time you prescribe, that is the only the partial remedy in your hand. That is to say, not exactly suitable as there was no considerable number of symptoms to guide to an accurate selection. So this is what something happened with all of us also in our clinical practice. So in the first case taking, we are very what we call as we are taking the whole case in a detail and we prescribe. And when the patient comes to us in a follow-up, we desperately feel that we find the best medicine, but it didn't work, or sometimes it worked only partially and then we are in the chaos. So at that time, what to do? So in this case, the medicines which has been chosen as well as was possible, but which for the reason above stated, that means the reason is that there is only few symptoms, that is only imperfectly homeopathic. Will in its action upon the disease that is only partially analog to it, and just as in the case mentioned above where the limited number of the homeopathic renders the selections imperfect, produce accessory symptoms. So many a time what happen you have prescribed some medicine and patient come with a different set of symptoms or patient come with the symptoms of the proving of that medicine. So sometimes that symptoms is taken into considerations and several phenomena from its own area of the symptoms are mixed up with the patient's state of health which are, however, at the same time symptoms of the disease itself. So whenever the symptoms happen, that symptoms is not a proving symptom, it is the disease symptom itself, although they may have been hitherto never or very rarely perceived. Some symptoms which the patient has never previously experienced appear. So sometimes patient says, ऐसा तो मुझे कभी हुआ ही नहीं, इस बार आपकी दवाई शुरू की है तो ये हुआ है. So that is called as association. And the other he had felt only indistinctly become more pronounced. पहले थोड़ा थोड़ा होता था अभी ये बढ़ गया है. So that is what some symptoms are occurring. So in that case, what to do? So let it not be the objected that the accessory phenomena and the new symptoms of this disease that now appear should be laid to an account of the medicament just employed. So this is very important that whenever these symptoms has to become, we have to take into considerations into totality. They owe their origin to it. That means what? So in aphorism, footnote number 111, Master Hahnemann said, when they were not caused by an important error in judgment, or a violent emotions, or a tumultuous revolutions in the organism, such as occurrence or the cessations of the menses, conceptions, childbirth, and so forth. So many a time the patient has you are treating a case of a chronic case, and the patient got pregnant suddenly some new symptoms has been developed. So that is the different set of symptoms. That is not the one-sided disease symptoms. So that is what you have to keep in mind. So what Master Hahnemann said is they owe their origin to it, certainly, but they are always only symptoms of such a nature as this disease was itself capable of producing in this organism, and which were summoned forth and induced to make their appearance by medicine given owing to its power to cause similar symptoms. So what happens whenever the patient having some other symptoms or sometime a violent emotion causes a symptom. So you are treating a chronic case. and suddenly the patient develops some emotional trauma, and after that you get acute pictures, and on the basis of acute pictures you have prescribed, and that medicine is what we call as a simillimum to hold the case. So that is sometime it happens. So, in a word, we have to regard the whole collection of the symptoms now perceptible. That means the previous one-sided disease as well as the new set of symptoms developed after the certain origins perceptible as belonging to disease itself. That means the whole phenomena that we call as the conceptual dynamics as the actual existing conditions, and to direct our further treatment accordingly. So on the basis of the totality of that things, we have to taken into considerations and prescribe. So this is what Master Clement telling us. So in one-sided disease, many a time you get with the partial minimum, and after that some phenomena happens, and you get suddenly you get the remedy and you get the cure. So that is what Master Clement has mentioned. So this is the few wisdom of our Master Clement to all of us in treating the cases and helping the suffering humanity with the divine homeopathic science. Now we are continuing with the genetic materia medica. In genetic materia medica, we have as far as covered the Paraita group, we have covered the Calcarea group, and we are continuing the Kali group. So up till now, we have understood in a Kali group that the physiology of potassiums in our body and the cells, and understanding that physiology, we can understand the certain phenomena what Kali patients reflect to us in our cases. So further continuations of this Kali group, we are reading the genetic reflections, genetic miasmatic reflections of the Kali group or the Kali Carb. So Kali Carb in Sora or normal physiology, potassium forms the constitutions of the every nerve and the muscle cells. The involuntary muscles of the heart, esophagus, intestine, the sphincter of the rectum, bladder are all influenced by the potassium as much as the voluntary muscles of the back, hand, and legs. So SORA, the physiological defense, that means the inflammatory defense, may causes at the physical organ and the tissue level, irritations and inflammations in the fibrous joint, pleura, larynx, and the muscles. This is accompanied by mental generals attribute of the easy excitability, irritability, easy startling, easy anger, quarrelsome, argumentative behavior, tremendous anxiety, impatience, impetuous behavior, etc. He become oversensitive and the horrible sights and story affect him profoundly. When Sura blossom into syphilis, these traits are exaggerated and the person become very, very panicky, full of anguish and angered easily. So this is what very important. The Sora is in control when the Sora goes exaggerated, out of control. So that is leading to this the panic state and anger and the anger disease. Physically, heart muscles become easily excitable and the patient gets palpitation sensation as if heart is hanging by the strings. Physically, he becomes intolerant to the touch. When Sora blooms, when Sora blooms into psychosis, there will be a weakness, the laxness of the muscles of the heart and the muscles of the back and the extremity. It will give rise to the obesity, dullness, lack of control over the stools and the urine. So weak bladder sphincter gives the difficult urination. So weak muscles gives the lumbago, lame back or the lame leg. Weak involuntary muscles gives rise to a dysphagia, difficult menses or sometimes amenorrhea. In mind also, it causes difficulty in remembering, this resulting in loss of memory for what he has just done and loss of word while speaking. So this is what something the patient comes to at मैं क्या कर रही थी? So sometimes the lady goes to kitchens and making some food stuff or cooking, and suddenly she went to the freezer and she want to get something, and suddenly she forgot that मैं क्या लेने आई थी. So that is what something that loss of memory what he has just done, or sometime while speaking मैं क्या बोल रहा था, loss of word while talking. So this is what something the memory weakness because of this Kali group. So people who have been very, very active, hyperactive throughout their life, then they go into old age memory problem. Kali cough should be thought of. If the patient's having a weak back, paratic muscles, or the people who are fat, slow, dull, come to us with a past history of being just the opposite, that is being hyperactive, excitable, irritable, impatient, etc. One should start thinking of the Kalika. So this is very important. Previously, he is very, very excitable, hyperactive, irritable, and now they become dull, sluggish, fat, slow, and paratic. Think of Kalika. One of the important point that never well since the parturitions or the delivery or a loss of fluid or excitement or a mental work or the physical exertions. This shows that whenever the neuronal tissues are under stress or mental exertions, whenever the muscle cells are overstressed, whenever there is excitement and now under stress, whenever there is a parturition or when there is a loss of vital fluid or a sexual excess, this miasmatic defense or gear change to either excess or dullness. So in excess, it produces excitability, the neuronal activity or the muscular activity to give rise to anguish, palpitations, and pulsations. Or when it goes into a dullness, gives rise to relaxations and weak muscles. And thus, if a case of a cardiac neurosis or a cardiac anxiety comes to us with the history of the previous excitement or a stress, the patient can be Kalika. This is what very important. Many a time in cardiac neurosis is a one-sided symptom. So in that case, you didn't find any more symptoms. So, but you find the history like this, you can think of it as a Kalika. If a case of motor neuron disease or myasthenia gravis comes to us after a known history of loss of vital fluid or after a mental or physical exertion, one should try and find out whether he is Kali or not. So in the clinic, what can help us to recognize Kali cough depend upon the miasm. So when the Kali patient comes to us in the soric stage, what was the symptoms? The symptoms is easy. In SOA, it is marked by the easy, so easily anxious and frightened, easily irritability and anger, easy quarrelsome, easily startled due to timidity, easily worried, tense, fearful of disease, easily tickled, easily shrieking, easily revolting, easily discontented, sad and sullen, easy tiredness and perspiration, so easy excitement. It is a soric trait of the Kali. So when this Kali patient goes into psychotic trait, how they represent to us in the clinic. So the word for the psychosis is in psychosis, the certain trait has that are difficult. So what is the difficult? So difficult weak muscles. So weak back muscles, easy sprain, weak circulation causing edema, puffiness above the eyes, causes a difficult urine, difficult stool, difficult breathing, difficult walking, difficult menses, and ailment from sexual excess or mental exhaustion. So when this Kali patient comes to us in psychosis, everything is difficult because of weak muscles. Whenever the Kali patient comes to us in the clinic in the syphilitic state, so in the syphilis, there is certain trait are the excessive and hysterical. So excitement goes into exaggeration. Excitement goes into a hysterical form. So there is a excessive anger and easy quarrelsome, the excessively anxious, the frightened and startle easily, excessively worried and tense, excessively tickled. So Sora get converted into exaggerations, excessively shrieking, excessively revolting, easily discontented, sad, sullen, horrible thing of profoundly easy urine. So that means the coughing, involuntary urine while coughing. This is the symptoms of the thalicab and causticum. So the hysterical excitement are there in the syphilitic thalicab. So how Kali present? So anxious lady who expect quick result and pester the physicians with too many questions. So the Kali personality. Those who are not easily satisfied with the treatment and go on complaining anxiously. This is also Kali Cup. They quarrel and demand from physicians but do not leave the physician. Very, very PQRS symptoms in most of cases whenever the person do not leave you. They quarrels with you, they demand something from you, but they doesn't leave you. These are the Kali people. Because Kali are more routinistic. So they want to be in a routine. They don't want to change. People who are too much worried about the health, people who startle easily, the children who get tickled easily and do not allow any touch on the soul. They wear their own socks and shoes. The children who, though fearful, do not like to be carried in fear of being tickled. People who are sad when they are ill and moan and groan and become impatient and irritable. And menses too much delayed by the month. So this is what the few indications of the female patient to you. They are so in symptoms of the mind, we have to divide a soric kalika, psychotic kalika, and the syphilitic kalika. So in soric kalika, the irritability, anger, fright, startled, and shriekings are very, very easy. Emotional reactions are irritable, ardent, easy fear, fearful, anxiety, and easy depression. Whereas in psychosis, there is the element from mental fatigue, difficulty in remembering that memory is weak, memory weak for loss of word, sad and discontented. And in syphilitic, they become panic state, the shrieking and the touchiness, the hysteria, and there is a violent and revolting kind of characters. They also affected by the horrible sad story affects her profoundly and excessively goes into loss of memory for what he has done. So there is no joy, no love, there is a sensitivity and the quarrelsome. These are the soric symptoms and the complaint, soric complaint like the bronchitis, asthma, backache, knee pain, joint pain, hip pain, sciatica, gastric disturbances, easy sweating, easy tired and easy urination, easy sensitive to noise and fear of starting, and sensitive skin, touch, smell, nausea from smell. These are the soric symptoms. When goes into a psychosis, there is a relaxation of the tissue. So in relaxation of the tissue, the bladder becomes weak and difficult urination. The muscles become lax, difficult walking. The back become weak. So there is a constant backache. Back gives out. The circulation become weak, which causes the edema and accumulation. There is a looseness of the tendon. So out of this, there is a difficult breathing, difficult stool urine, difficult menses, and difficult to expectorate or swallow. There is one point, there is the element of the sexual excess. So there is the excitability is there, and then suddenly goes into drowsiness, sleepiness, weakness, and laziness because the more of the potassium has to go inside to the cells with utilization of the ATP. Never well since the parturitions, aggravation after loss of fluid, aggravation after poisons, tendency to become fat and obese, easy sweat, weakness of the back, aggravation at 2 to 4 a.m., and edema of upper eyelid. So these are the few indications of a psychotic kalika. And when the kalika patient goes into syphilis, they produce a cancer, they produce a leukoderma, they produce a avascular necrosis, osteoarthritis of the knee, fatty degenerations of the heart muscles. Along with there is a palpitation, pulsations, and the nausea. It affects the muscles, blood vessels, circulations, electric circuit in the heart, pulsations in the toes and finger and the body part. There is very PQRS sensation which I have shared one case of hollow sensation yesterday. So there is a hollow sensations in the part as well as in the body. Due to overexcitability while eating, they goes into sleepiness. So sleeps after eating or sleeps while eating, weakness after eating, alternates get the soric pains alternating with the syphilitic pain. So this is what the Kali personality is. And the miasmatic reflections of the Kali group at a particular group. So Kali Kap can be sorosoric, and soropsychotic, or sometimes they go into syphilis. Kali Mure is more soric, psychotic. Kali Force is psychosis. Kali Kav is psychotic, Posticum is psychosyphilitic, Kali Iod is more syphilitic, Kali Ars is more syphilitic, and Kali Proms is more syphilitic. So again, the miasmatic reflections also help you to understand that it will gives rise to indications of particular Kali when you are treating a such kind of syphilitic patient or a psychotic patient or a sphoric patient. So basic resume of the Kali Kav. The triad of the Kali Kav is the timid, startling easily and anxious, anger, aggressive and argumentative and quarrelsome, quick, rapid, impatient, irritable, sensitive to touch and ticklish, chilly, right-sided, thirsty or thirstless, aggravated 2 to 4 a.m. These are the few indications of the Kali Kav. So other Kali salts. So other Kali salts are the Kali Ars, Kali Iod, Kali Blue, Kali Phos, Kali Sulf, Kali Chrome, Kali Bichrome, and Causticum. All these salts have their own peculiarity in the drug proving, along with a lot of features common to the Kali element. So once the Kali element has been identified, the salt can be zeroed in by use of the individual particulars or peculiarities of the salts coupled with the thermal and thirst. So this is what we have to understand. So Kali Rs, every time when we understood the arsenic element is associated with any of the drug, what was the things associated with the arsenic? So arsenic becomes very, very anxious. Arsenic is more concerned about health. Arsenic is more about the fastidiousness. Arsenic is more about the time punctualities and everything. So the few element associated with the Kali which gives you a good pictures of the Kali Rs. So Kalias will be best understood with the help of the case given below, in which it was prescribed with very good result, and that is with the reversal of the symptoms according to Haring's law of direction of the cure. So the case, a 37 years old lady came to us with vitiligo since 2 months. Previously, she had developed some fungal infections, the psychosis at the knuckles, elbow, and the leg. She had applied some antifungal ointment on it. Later, there is a crack. The syphilis started appearing on the right corner of the mouth, followed by involvement of the left side. She went to the dermatologist who prescribed some lotion for it, after which skin at the corner of the mouth started becoming hypopigmented. Therefore, the destruction that was in the epidermis went into destruction of the melanocytes. When this happened, she got extremely anxious about her conditions and would not get sleep. Her appetite decreased due to this anxiety and her blood pressure went up. Her whole nature changed. Earlier, she was very, very extroverted lady, full of life, vivacious, cheerful. When diagnosed with the leukoderma, she became sad, melancholic, and developed tremendous anxiety. She would not even go and look up in the mirror. She would get many thoughts about her disease, like these spots are incurable and that they would now spread all over the body, and she would not be able to face anybody. She had become so sad that she had lost interest in her family and daily life. She became irritable and quarrelsome and would be jealous of other ladies. They looked so beautiful. So also had a fungal infection and she also applied the same cream. So why did I only get this disease? So this is very important. Jealousy, general sadness in. The rubric is very important. This is a Kali Rs. And indifferent apathy, they goes into a state of sadness and indifference after they disappoint. She would not go out since people would ask her about her skin, which would cause her to become sadder. She was very, very particular about the way of keeping things in the house and her children's studies. But once she got this illness, she lost interest in whether this to be or not. She only thought about her illness. She also became very impatient and she would want instant result from every doctor that she went to. indifferent, apathy, sadness, restlessness, midnight after. At night, she would get up after 12 a.m. and start pacing the floor. When she comes to us for the consultations on the first pay, they made a lot of inquiry with all the assistants. Is this leukoderma or is this cancer? Has your sir treated such a cases before? Does it get completely cured? From this, we see that she was basically a very, very timid person, extroverted person, and cheerful. But on falling ill, she had all qualities of the Kali arts. So there is an anxiety about health, there is a hypochondriasis, there is a fear happen something will. This anxiety of the health leading to sadness when the ill and the fearful of major diseases like the cancer. Improving symptoms that have come up that are that of Kali as well as arsenic. Kali as well as arsenic. It has all the basic features of the Kali that being timid, anxious, having startling tendency, easy excitability, and quarrelsome. To this added the features of the arsenic. The arsenic imparts the following natures to Kali as the fastidious, restless, anxiety, anguish at night, fear of incurable disease like a cancer, censorious, critical, company desire for fear, panic attack, overpowering, quarrelsome are the Kali hours. So in Kali hours, we have the anxiety of health, indifferent apathy to family, sadness when ill, sadness causes indifference, sadness causes morose, sadness causes quarrelsome, sadness causes jealousy, sadness causes quiet dispositions. So this, whenever you find this the sadness with this component, you can think of it as Kali hours. When to think of Kali hours in the clinic? So when the people who, when ill, only think about their illness and become completely indifferent to the daily course, that are the Kali hours. People who complain about the small, small things, people who never get satisfied with the explanations and go on asking questions. These are the Kali hours. People who become easily sad when they are ill. People who get 3 a.m. aggravations and after midnight, people who suddenly get up in the middle of the night and anguish and panic grips them. So miasmatically, the miasm, syphilis, physical generals, chilly and thirst. So the resume of Kali Ars is not Kali Kam, it is a Kali Ars. So resume of Kali Ars is anxiety about health, chilly, Kali, which is not angry. There is a sadness about the health, indifferent to families and everything else, and 3 a.m. aggravation. So this is what the reason of Kali asks. Now, primary comparisons and the differentiations, the Kali are these people who, when ill, only think about their illness and become completely indifferent to the daily course. This condition attract our attention because the patient becomes first of all sad when he comes to know that he is suffering from the diabetes or the thyroid, etc. He is so much anxious about his health that he thinks about it continuously and can think of nothing else but his illness. In the bargain, everything is meaningless. His family, his children, his duty, and his daily work, everything takes a back seat. This reactions, if it comes only once, it should not get much importance. On the other hand, if the person becomes sad and indifferent when he is diagnosed as incurable disease like a cancer, it again becomes a natural reaction. If any person is told that your days are numbered and that you have to only 3 months of life left, he will become sad and go into depression and will develop indifference to everything. This is but natural and should not be taken as a remedy symptom. But if for any small illness, this is very what sir wanted to understand. That if for a very small illness, one becomes recurrently sad and indifferent, this becomes the symptoms of the constitutions. So this is what keep in mind. This becomes the genetic reactions of the remedy, and it is important. For someone suffering from diabetes or thyroid, one need not go into indifference to everything. But if he does, it becomes important. The remedies or the constitutions that have indifference and the sadness with the illness are the Kaliyars. Calibrom, Platina, Helleborus. So in Calibrom, there is a marked restlessness, there is a fidgetiness, anxiety with a changeability, and the fidgety fingers. These are the indications of the Calibrom. Helleborus is extremely slow remedy, slow to answer, slow to react. And the Platina, this is an extremely haughty aristocratic remedy as compared to the others. Differentiation with arsenic. The arsenic is ambitious for the money and the fame and is awareness which is not there in Kali Ars. The anxiety of the arsenic is graceful. The sitting postures and the body language of arsenic is aristocratic. The arsenic answers slowly and aristocratically. While Kali Ars has aggressive anxiety, no holds bar, they can trouble you. Arsenic will not trouble you. This is very important. Arsenic is a sober and graceful personality, so they cannot trouble you. So arsenic can easily anger remedy. Kalias is not an angry remedy. It does not have Kali Kaab anger. Arsenic has anxiety of conscience, therefore will not trouble the doctor. Kali has no anxiety of conscience, therefore will trouble the doctor. So these are the few indications and considerations of Kali arts. Now we are further going towards the Kali iodatums. The Kali iodatums, it is a syphilitic Kali with all the qualities of the Kali like startlings and touch aggravations, but is very unfeeling and hard-hearted toward the family and the children. So very important. Kali iod is unfeeling, hard-hearted toward the family and children. Startle noise from irritability children towards. One may think of Kali iod when there are violent pains which makes him shriek. The pains may be in the head or in the knee. So Kali iod in the olden books it was written that it is the remedy for the osteoarthritis of the knee joint. Has more actions on the bones, nerves, and the glands. In the bones, it causes decay. In the nerve, it causes spasm and convulsions and jerk. In the gland, it causes atrophy, memory, and the testes. There is one rubric, there is a shrieking pain with the pain in the knee, thigh, and leg while lying down. Kali iode has specific actions on the tongue. The tongue gets pulled inside the throat, which with a severe stinging pain causing the person to suffocate as if he is falling asleep. This is a syphilitic affections of the tongue and the throat. The fear of that of pain with the root of tongue and the throat of before going to sleep. So this is very important. The tongue may fall down and he feels that he might not get breathing and he may die. So this is what very important understanding in this case. So it is a syphilitic affections of the tongue and the throat. Discharge bloody green, greenish black, like any other Kali aggravated by the mental work. Sadness of the health leads to the cruelty, harsh, rough, malicious, irritable, hatred to the children, abusive, insulting to the families and the children, aversion towards own children. When she is well, she is very, very loquacious and jesting. But when she is ill, they goes into a sad, malicious sadness, and sadness lead to this cruelty, harsh, rough behavior, and malicious and irritable. So harshness, roughness, sadness in sadness, aversion to see her children from the sadness, and children to whom he is devotedly attached to become. Cannot support injustice, so there is a sensitivity to injustice. 5M aggravations. Hot patients, the Kali iode is a hot patient relieved by the cold, relieved by in a open air. Very good remedy for the eye paralytic conditions. So in eye, the paralysis of the eye, the nerve effusions nerve, muscles of the eyeball recti and muscles of the eyeball, and optic nerve amaurosis. So I had a case. This is not a case of Kali iode, but I had a case of the hospital, right-sided uh, six cranial nerve number 6 is paralyzed. Oculomotor nerve is paralyzed. and one eye be closed. So this is what I have treated. I will share this case in the group later on so that you will get idea, or we will share in the Zoom meet when the posticum we were reading posticum. I will share that case. Very good remedy for the eye paralytic conditions, the paralysis of the lateral recti leading to the internal squint and the detachment of the retina. So Kali iode is a syphilitic remedy. Another remedy is Kali Mure. Again, Kali Mure. Mure can be chilly, Mure can be hot. So it is a chilly, thirsty, and Mure always introverted. So it is an introverted Kali. It is a slow Kali. It is indifferent Kali. So this picture, the picture is more or less like a sepia. The patient is indifferent, indolent, and sit quiet and stiff, not interacting with the people. The person has no interest in work, no interest in doing important things. He neglects important things. They sit in one place, occasionally humming a song to themselves, and the song too is sad, slow, and melancholy. He talk less, but when he talks, he get excited, and the speed and the speed of the speech become faster and higher respectively. So there is an indifferent apathy to all persons, sits quiet and stiff, aversion to friend. The only things which Kali in the Kali Mure is startling tendency. He is startled easily from the sleep by the slightest noise. One thing marked is water can take the place of the food. If the patient is hungry and he drinks water, the appetite disappears. So appetite increase, hunger in general vanishing, drinking water after. So this is very important. Appetite increase, hunger vanishing after drinking water. Cannot tolerate rich food and the pastries which easily upset stomach, and hence they develop an aversion to it. So this is what again like a pulsatilla you can think of. At the physical level, Kali Mure exhibit only the superficial inflammations of the throat with a cheesy lump being worked out. Even in eyes, there will be a superficial inflammation in the cornea causing keratitis. So inflammations occur in the blood vessels, giving rise to the blanching effect, that is whiteness of the part, otherwise it is a red. So very important that discolorations, whiteness of the part usually red. This is the indications of Kali. In psychosis, inflammation turns into indurations and the arteries get thrombosed, giving rise to the heavy leg sensations. Chronic inflammations can cause a chronic nephritis and the chronic renal failure. So, Kalika we can think of in the chronic renal failure. In the breast, there may be a painful nodules, but when psychosis and syphilis combine, they may go into cancer membrane. Inflammations in the tongue turn into tumor of the tongue. So this is also a Kali. Kali phos, another Kali phos, the resume of the Kali phos, the phosphorus having a mental exertion. So Kali phos is a remedy for the brain. It was a Schussler has given that it is a brain tonic. So Kali phos is for brain. So most of time the phosphorus giving rise to this. So and Kali giving rise to this. So Kali phos tired, there is a mental exertion aggravation. So this is what the remedy for the worn out businessmen who have a lot of mental exertions to do the business, worn out housewives, worn out the school girls and the boys who are having the mental exertions from the over studies and everything. So this is what the Kali phos is. Whenever you find there is a mental exertions aggravation, you can think of Kali phos. Chilly, thirsty, timid, easily startled, easily frightened, easily excited, and startling on the touch, consolations, aggravations, and there is the physical symptoms like offensive discharge, putrid, cadaverous, offensive discharge from the ENT, menses, leukorrhea, and even blood. So whenever you find this type of the triad, you can think of it is the Kali phos. So this is a chilly, thirsty, and the left-sided remedy. All Kalis are the right-sided, whereas the Kali phos is the left-sided remedy. It has all the characteristics of the Kali, like the humidity, easy startling from the touch, noise, frighten easily, shrieking easily. Important point to note are the mental exhaustion aggravation, consolations aggravation, and offensiveness of the all distance. Now, what is mental exertions? The Kali weakness is due to the excess use of the energy to operate the sodium potassium pump that sends the potassium ion back into the cell. This weakness is exhibited in the different tissue depending on the affinity and the constitutional type. The excessive activity of the Kali, it means the excessive excitement or excessive use of the cells, will give rise to the phosphorus type of the weakness in the brain and the nerve cell. The brain and the nerve cells are so weak that it cannot bear any exertions. We can think of Kali force when we see. When to think of Kali force when we see the delicate school girls who are tense about the study, who are anxious and worry a lot before exams, and who exert a lot to study and start getting headache, maybe the Kali force. It generally corresponds. So headache, head pain, general school girls in. Overburdened businessmen, when we see the businessmen who are tense about their business and uses their mental power a lot for the same, but after overuse they become weak in the mind, then the slightest thinking gives them a headache or the irritability. In such cases, one should try and find out whether he is a Kali force, applying and confirming with the generals. So, worn out businessmen, anxiety business about when we see the overburdened housewife, the housewife who are overburdened with the work, who put in the 100% in the home duties due to their over enthusiastic nature, trying to take the responsibility of all, everything, and everyone, she will not be able to sustain consistent exertions of the mind and the body. Finally, the brain gives way and they start feeling that if they still overwork, they will go crazy. Then mental work become impossible. They get such an brain fag that they are averse to answering the questions. They are averse to staying in the family. They develop aversion to family and to the husband who constantly demand duties and work from her. The work crazy seems to drive him in a mental occupations owing to the impotency of the mind. Thus, the Caliphos can fall ill, fall ill. It is not tall ill. Thus, the Caliphos can fall ill when it exerts its mind. Ailment from the grief, anger, disappointment in love, and the shocks are the indication. The second point is the consolations aggravations. The brain has taken such a beating that it refuses to think. The Caliphos patient is so averse to the thinking, whether good or bad, that that any consolations is also a pain for her. So Caliphos get angry at consolations because consolation is going to make her think and that she cannot afford. So Caliphos is so mentally tired that it has no capacity to think anything good or bad if any consolation is given to her. Even to think of that consolations, she has to use her brain, which she cannot do since using her brain lead to the brain fat. There are other remedies that comes to our mind when we see the patients who does not like consolations. There are the natramure, calcarea, and the platina. Platina thinks they were too exclusive. The platina thinks she needs no consolation as it is gifted enough to take care of herself. Palladium does not like consolations but like praises and appreciation. So, when there is a liking for appreciation, there is no scope for anybody to console her, which makes her feel deficient, which she can ill afford. So, we have seen one video in yesterday or day before yesterday sessions where you feel that the palladium does not like consolation and they are fond of getting good opinion of others specifically for her concern of the looks, aesthetic looks. Natramure is exclusive because of hypersensitivity and she cannot afford consolations. Even little things hurt them and they hurt them badly. They go into brooding and extreme sadness. So we know the consolations, aggravations in Natramure. Sepia also had consolation since it has gone into indifferent mode It compromises itself with the grief and decides to go ahead in the life in spite of the grief, vexation, suppressions of the anger, etc. Sepia is a negatively positive remedy, so it goes on living its life and is not bothered about such things and would not like emotions to come in its way. This is what the sepia is. Arsenic consider itself as a self-sufficient, meticulous, methodological, and consider itself to be in the positions to manage itself. Hence, it does not require any outside consolation. Carcinosin does not like consolations. The carcinosin is very introverted personality. It has been put into a mold by either parents or molded by itself in a particular manner and will not be molded by external influences in the form of consolations. The only things remaining in carcinosin is sensitivity. The reaction has been cut off and she has been programmed by her parents who have molded her. Ignatia and Cilicia both are remedy of esteem, though conscientious and very sensitive. Ignatia is not timid and again consider it is self-sufficient and hence therefore does not require any consolation, which on the contrary aggravates them. Cilicia hate consolation because of their rigidity and esteem nature. And the third point in this remedy is over offensive discharge. So the anyone who complain of the offensive discharge should be probed to see whether he is Kali false. In one word, in Boger, it was written that adynamic conditions. So in adynamia, there is everything is accumulated and the accumulation lead to the offensiveness and everything. So there is a adynamic. There is a fever which is called a septic adynamic fever. That is also the Kali force. So remedy that comes to our mind if the patient complain of the bad odor from the mouth, stool, urine, or any discharges, we can think of carbovage, califor, sorinum, and arsenic acid. So what are the things which is offensive? The hemorrhagic tendency, which is offensive, the expectorations offensive, menses offensive, lochia offensive, leukorrhea offensive, urine odor offensive, stool odor offensive, and ear discharge general offensive food red meat like. So these are the indications of Kali phos. Carbovage, which represent the carbon, causes stasis with the gastrointestinal and the stasis of the cardiovascular system. When there is a stasis, nothing inside moves or moves slowly. The bowel also do not move, hence there is no throwing out of excretions or the waste product substance, causing the whole system to go into this offensive putrid or cadaverous mode. Anything that comes out is foul swelling because of decay. A similar thing occur in California. The only difference is that here the brain and the nervous system is slowed down, leading to the disturbances in the metabolism. Also, the nerve slow down in ordering any evacuations and thereby resulting into putrid, cadaverous, and offensive discharge from the ear, nose, throat, and in the form of stool, urine, leukorrhea, menses, and lochia. All offensive or foul in order. In Caliphos, even hemorrhage have a putrid order. This is very important. If the body and the system has slowed down and the mind is active after a major illness to give rise to a foul discharge, the remedy indicated could be carbovage. If the mind has slowed down and the body is relatively still excitable, one can think of the Kali phos. This is the difference between Kali phos and the carbovage. uh, arsenic alk, the offensiveness is due to the destructions of the tissues and not due to the stasis or disturbance metabolism. Sorinum offensiveness is due to anaerobic infections. The bacteria thrive on lack of oxygen and less amount of the oxygen in the body give rise to a putrid odor to stool and the urine or a pus from the ear and nose that is also yellow green color. Beside this, some other points that may attract our attention to Kali Force are emaciation in spite of eating very well and emaciation in spite of having a ravenous appetite. Tremendous weakness from the mind-related body stress. For example, aggravation, poisonous aggravation, climatrix aggravation after acute disease, and that causes concern. Urine is golden yellow and hungry after eating. The person is hungry even after eating. Another remedy which we are going to learn today is the Kali sulf. So we all know that Kali sulf is the analog, similar analog to the pulsatilla, a vegetable pulsatilla analog to the Kali sulf. So Kali sulf is pulsatilla with a few differences. So it resembles pulsatilla in the following space, like changeability. Both have changeability. Pulsatilla has a changeability of moods, wandering symptoms, the pain wandering, especially in the limbs and the back, open air aberrations, and warm room aggravations are both in there. Kali sulf and the pulsatilla. Timidity and frighten usually both are irresolute and indecisive. Heated becoming aggravations, evening aggravations of anxiety and other complaints, and hot drink aversion. These are both are the same similar resemblance of the pulsatilla and Kali sulf. What are the difference in this? So difference is like this. Pulsatilla likes sympathy, whereas Kali sulf hates sympathy and also the element from sympathy. Pulsatilla consolations, ameliorations, whereas Kali sulf consolations, aggravations. Pulsatilla is thirstless. Kali sulf is extremely thirsty with a burning pain and vehement thirst. Eating aggravates pulsatilla. Kali sulf eating ameliorates. Never well since menopause in pulsatilla. Never well since abortion, any major illness like pneumonia, etc. Feels she is neglected, and Kali sulf has only one delusion, and that is feels she is disgraced. The other unique complaints that may draw our attention to the Kali sulf are when the nails suddenly stop growing after an illness, you can think of it is the Kali sulf. We see a non-healing ulcer constantly discharging yellow water. It's a flowing ulcer. Flowing ulcer, you can think of Kali sulf, Kali arch, Kali carb, natrum carb, rustox, and zinc sulf. When we see people with warts on the tongue or warts on the lip, you can think of Kali sulf. So Kali sulf children are the mild, delicate, fair skin, red lipped, and timid like pulsatilla, but very restless. During fever, these children are not bothered about the temperature and keep on playing and jumping about while their parents are more worried. They get recurrent attack of bronchitis after the major attack of pneumonia. After pneumonia, they get recurrent bronchitis. So these are the indications of the Kali sulf. So we conclude the day today here and we continue tomorrow with the Kali Brom and Kali Bichromicum. So our Kali group will be finished from tomorrow. Hope you enjoy reading this Readers Club activity, and together we learn in this Readers Club. And I have also shared previously that if you have any case you have treated after that this reading club, so you please put your case into a group so that other can also learn from you. So we will conclude our day today, and thank you so much. Thank you all.